Welcome to our PFAS Town Hall. I'm Susan Wood with the Pennsylvania Department of Health. We are here to discuss a large, complex group of man-made chemicals called PFAS, and that stands for per and polyfluoroalkyl substances. And what this group of complex chemicals does is they are used to make things, consumer and household products, more water resistant and more stain resistant. Most people in the United States do have some level of PFAS in their blood, and those living in the communities where the PFAS has migrated into the drinking water supply generally tend to have higher than normal levels. This is what we found in a small study in the greater Horsham, Warminster, and Warrington area back in 2018. So now we are conducting the PFAS multi-site health study in Pennsylvania. It's happening in this community to examine the potential health effects of PFAS contaminated drinking water. So this is part of a national study. There are 7 other sites across the nation, and people in this community have been really incredibly supportive of this health study. And we've had hundreds of people that have signed up and have been participating in it. And so we're very, very thankful for that. And I'd like to introduce some of the key players in our study team and 2 of the legislators who have been extremely helpful in our efforts to study PFAS contamination. Our PA-PFAS multi-site health study coordinator is Dr. Christine Wyant with RTI International. We also have Hope Gross and Joanne Stanton of the Bucksmont Coalition for Safer Water. Plus, we have 2 legislators who have been very vital to our work on the PFAS health study, and particularly vigilant in their attention to PFAS issues. So we have U.S. Representative Brian Fitzpatrick and Pennsylvania State Representative Todd Stevens. Gentlemen, we would love to get some insight and hear your thoughts and concerns about the PFAS contamination in this region. I'm going to pass this over to Hope and Joanne with Bucksmont to ask you both some questions on behalf of the community.
Good morning, gentlemen. Thanks for joining us. Rep Fitzpatrick, what was your initial reaction when you first heard about the PFAS contaminated drinking water in our community? And how did that propel you into action as a legislator?
Yeah, thanks. Thanks for having both Todd and I to join you today. As a community, I felt that we have to learn more about, from day one, more about the hazards of long-term impacts of PFAS. I came into Congress succeeding my brother, Mike, who had done a lot of work in this area. And we had quickly learned that several townships in our community were at 10 times the recommended 70 parts per trillion limit of exposure. Since we first became aware of this contamination, our constituents were forced to take drastic action, mostly at personal expense, by the way, to reduce their exposure to the PFOS and PFOA. And the federal government caused this public health crisis. That was the results of our investigation. And we have to continue to hold them accountable to remediate the situation. The Willow Grove site had a huge impact on why I teamed up with Congressman Kildee, who represents Flint, Michigan, to form the bipartisan PFAS task force. We had a lot of individual members who represented areas that were impacted, many involving military installations. And we found that by just collecting all of our districts together, forming one task force and speaking with one collective bipartisan voice would be the most impactful, and that's what we've done.
Thank you. Joanne?
Yes. Representative Stevens, you grew up locally in Horsham, and you have been here in the community your whole life. Can you describe how you felt as a parent when you first heard about the contamination and how it propelled you into action as a legislator?
Sure. First of all, thanks for convening this really important discussion. And I appreciate all the work that you guys have done to raise awareness on this issue. This really hit home for me when I first learned about it. I was reading an EPA fact sheet when I first became aware of the PFAS contamination of the public drinking water system in Horsham. And, the first question on the fact sheet was, is the water safe? And the answer was, yes, don't worry, all the wells that exceeded the health advisory level have been taken offline. But when you flip that page over, about halfway down, there was a question, can I make baby formula with water coming out of my faucet? And the answer was no, that, you shouldn't use water containing any levels of PFAS to make baby formula. And, it was astounding to me. At the time, I had a 2-year-old. And so, having lived in Horsham my entire life and now raising my own children in Horsham, one of the reasons why I wanted to raise my own family here in Horsham is because it was such a great place for me to grow up. And, it made you wonder, geez, was that the right decision? Knowing that my children now had been drinking this water for a couple of years. And, what now do we have to do? Is there testing that they need to undergo to see if there was going to be, some health impacts for my child? What are the long-term implications? Then it occurred to me, obviously this was happening in my own home, but it was happening in every other home across not only Horsham Township, but the other communities that have been affected. And so it really prompted me to act quickly. And, I came out right away to say, look, we should have no detectable levels within our water system. And we needed carbon filters, blood testing to understand our baseline levels, and then a comprehensive health study. And that was back in 2016. Now, fortunately, through the collective efforts of a lot of folks, and Congressman Fitzpatrick referenced it, he's been a great partner, and before him, his brother was a terrific partner as well. So we've had a lot of wonderful partners at the federal level and at the local level. The folks at the Horsham Water and Sewer Authority, the folks at the Warminster Municipal Authority, they've all just done terrific work. And your organization has done just tremendous work to help raise awareness, bring this to light, and really get moving to eliminate these contaminants from our water.
Yeah. Thank you so much for that answer. It has been a group effort for sure. We've really worked well as a community. I'll pass it over to Hope now.
Yeah, so I know Representative Fitzpatrick, you mentioned you co-chair with Dan Kilty on the PFAS task force, and that's an integral, a very important part, pushing for PFAS blood testing that was ultimately included in the 2018 NDAA and subsequent NDAAs. So why do you feel blood testing is so important for our community?
Yeah, so when Dan and I first put that task force together, we generated a list of priorities. And when we learned about the pervasiveness of PFAS exposure, it just blew even our minds, even though we were well aware of the situation. You can imagine the impact it had on our fellow members of Congress who aren't necessarily dealing with this issue to the extent we are. And, Todd and I had a chance to tour the Warminster facility. I believe it was on August 16th, and Rob Billett was there, and he used a term that struck both Todd and I, that we're pre-polluted before we're even born with PFAS. That's how pervasive this chemical is. It is literally crosses the globe exponentially. The chemicals have serious health consequences. We know that. And the only way to test the level of impact on an individual is through blood testing, so that they can take efforts, whatever mitigating efforts they want to take from a health standpoint, to make sure that they're watching their health and their family's health. Shortly after I got sworn in fact, in March of 2017, I testified for the House Appropriations Defense Subcommittee. And I urged the panel for funding for cleanup and remediation. Remediation is the expensive part, as you know, as well as, and this was the second part, long-term health study on the impacts of PFAS and PFOA in the area that Todd and I represent, surrounding the formal Naval Air Warfare Center in Warminster and the Horsham Air Guard Station. So there's a number of vectors to approach this PFAS problem from. My personal view is that blood testing is the most important, from the standard of keeping people on top of their personal health situation and how much exposure they have in their own blood.
I have another quick question for you. Why is it that PFAS seems to be the one thing that brings politicians together in a bipartisan support for Congress?
Because it impacts 100% of the people that live in these communities that are impacted. There's no difference in ideology when it comes to keeping our kids safe and keeping our families safe. Everybody wants to do that as human beings. So when everybody learns of the, number one, the extent of the existence of these chemicals, And second, the harmful long-term health consequences and manifestations of it. That's one thing that brings everyone together. Our PFAS task force is extremely large. It's extremely bipartisan. And that's the way I wish every issue was, but it's certainly the case with this. And that bodes well for us getting our arms around this problem.
Representative Stevens, question for you. What are you most proud of as your role in, your large role that you have played in helping this community with PFAS issues?
I think one of the things that, came to light, initially we all scrambled and we tried to find funding for filters for each of our drinking water wells. And so in Horsham, that was 10 wells, or about $1 million a piece. So it was $10 million. Then Warminster had similar issues. Warrington was a little bit different because they were served by the North Wales Water Authority. And so they had alternative sources that were already clean. But either way, there was that initial capital outlay for a couple of the communities. But what occurred to me was that this problem was growing. We started to see PFAS popping up in neighboring communities in Upper Dublin, in Ambler, and Upper Southampton, and other communities, not where the bases were immediately located. And so it occurred to me that we needed a dedicated and recurring funding stream for PFAS remediation. And we have some programs in Pennsylvania for economic development that allow locally generated state tax dollars, so state sales and income tax, to stay local in a community for economic development. We have one up in Allentown, we have one in Bethlehem, and other places across Pennsylvania. And I thought, well, why can't we adapt that? And instead of using the money for economic development, let's keep the state sales and income tax revenue local and use that for PFAS remediation and infrastructure. And then on top of that, the ongoing maintenance that these filters are going to require.
So same question for you, Representative Fitzpatrick. What are you most proud of as far as your role in providing help to the community and things that are going on the federal side?
Yeah, thanks for that. I think that what I'm most proud of is leading the House and passing two what I consider landmark bills. One was HR 2467, the PFAS Action Act, and HR 7289, the Federal PFAS Research Evaluation Act. These two efforts make PFAS remediation a federal priority and will help begin halting the detrimental contamination of a wide range of per and polyfluorinated chemicals, including PFAS and PFOA. And consumer products and drinking water and a whole host of other products. As we've learned, it is literally everywhere that we look. Specifically, the PFAS Action Act established new requirements for the EPA to set federal limits on these substances. Similarly, the Federal PFAS Research Evaluation Act advances the federal government's focus and research on the long-term health and welfare effects of these chemicals. While these are positive steps in the right direction, enforcing safe national water drinking standards, we still have a lot of work to do. Obviously, as you know, you've seen the blood testing provision be attached to the NDAA. That is coming up again. That will be yet another opportunity for me and my colleagues, not just on the PFAS task force, but in Congress, to get additional standards and studies and funding, hopefully back to our community here, but certainly to the rest of the country as well.
Can you each describe what needs to be done at a state level, Representative Stevens, and then at a federal level, Representative Fitzpatrick?
Yeah, at the federal level, I think we need a national drinking water standard, first and foremost. Todd Stevens repeatedly and accurately has pointed out the absurdity of this patchwork of standards that we have from municipality to municipality. That should not be the case, nor should there be a patchwork from state to state. There have been a loud call from myself and Dan Kildee on the EPA, obviously, to designate PFAS as a hazardous substance under the Superfund Act and to establish allowable limits. Set the limits for what's okay and what's not okay. The 70 parts per trillion, most people kind of look at that and ask where that number came from. We want a number, if it's not non-detect, which I think it should be, something that's based in science and not just pulled out of the thin blue sky. Our task force, our job is to continue to stop the spread of the chemicals. And secondly, and more importantly, equally importantly, I should say, is to hold responsible for PFAS contamination the people that made the money on it, and the military obviously as well for their role in this, particularly the DoD. So going forward, Congress cannot further delay, I believe, require the EPA to actually accomplish all of these things, not just some of them. These regulatory actions, I believe, are a necessary first step towards giving all of our constituents, people across the country, protection they deserve for far too many years of inaction. I think the results of the blood test, that's another reason why they're important, because that will send a signal to the EPA, to our task force, to Todd's colleagues in the state level, how serious of a problem this is. We're going to have hard data. It's no longer going to be theoretical.
Right. I totally agree. And Todd, I think, for the state, you've worked hard on state levels, and I know our state, the DEP, they're working on MCLs and laws. And what is your input to that?
Yeah, I mean, unfortunately, I echo, it's a lot of the same initiatives, frankly, at the state level. I wish the federal government would move faster on some of these things, but when they don't, the state needs to step up. And so in general, my thoughts are that until you can prove to me that a substance is safe for us to consume in our drinking water, it ought to not be allowed, as opposed to this, the alternative process, which we seem to undergo, which says, well, we're going to allow anything in our drinking water until someone proves that it's harmful. I think the state needs to continue pushing its own standards then, preferably non-detect, and continuing to invest in those studies that are going to be necessary to, protect public health so that people can understand, what are the health effects they're facing and what do they need to do in order to protect themselves and their family members.
My question is for you, Representative Stevens, and Representative Fitzpatrick touched on this a few minutes ago. At the Health Study Media Day that you were both at, that we had in September, Todd, you seemed very moved when Rob Ballot, who was our guest speaker, noted that children were born pre-polluted with PFAS. You even noted it in your comments. Why was that so impactful for you to hear?
Well, just think about that. I mean, you're born into the world and you've already got contaminants in your body before you've taken your first breath. That is just astounding to me. These are through environmental, contamination. I mean, this is preventable. This is something that we can avoid. And, it just strikes me when you have, the most innocent of human beings, a newborn, who is already starting off with, a challenge and, some potential health effects before they've even taken their first breath. So, much like the impact on, children consuming baby formula is what really got my attention initially. I just think, I think of those kids, those innocent children that are being born, and they're already starting off, with these contaminants in their bodies. And that's something that certainly needs to change. No question about it. And we've got to get the data so that those families with those children can go ahead and protect them and ensure that they're healthy moving forward.
Yeah, it's important to remember or to reiterate that PFAS has the ability to cross the placenta, and it's also passed on to babies from nursing mothers. So this is a serious chemical for sure. Hope.
Well, as you chatted with us about at the tour, that you were able to participate, and I was wondering, how was your experience, and if you could share that with us so that other people maybe aren't scared or feel nervous about doing it, and maybe the time it took.
Sure. Yeah. The staff was very accommodating. They allowed me to complete the question. There's a fairly voluminous questionnaire to complete, but you can do that in advance over the phone, which, helped really reduce the time that you were there at the actual facility. And then, my time there was terrific. It really was almost like a routine visit to a doctor's office. You walk in, everybody's very friendly, some basic, just basic, height, weight, a couple other questions. They drew some blood, and, you're really in and out of there in a fairly short period of time. I really am looking forward to the results, because I've wanted to know what my baseline, standards were here in my blood as well. And So that information will be helpful to me. I'm really looking forward to getting that data and sharing it with my healthcare providers so that, if there's anything that I need to be doing or further testing that I may need, we can go ahead and get that process underway.
Thanks for participating in it. And we hope that the community continues to participate because we have a little bit more time left. And we thank both of you for being here today and continuing to help us and our community get clean water. And we totally appreciate your help with the DoD as well, fighting to get these bases cleaned up.
Thank you again both so much for being here. And Susan, we're going to pass it back to you for some updated information from our study team about where we are with study recruitment and what the next steps are.
So this study is so important, I think, for the greater Horsham, Warminster, and Warrington communities. Response has been truly impressive. Not all the communities that are involved in this nationwide study, I think, have had such a wonderful response. So Dr. Wyant, would you be able to tell us what our progress has been?
We are thrilled to announce that thanks to a very supportive local community, Pennsylvania is leading all other sites in virtually all aspects of enrollment. We are rapidly approaching our goal of 1,000 participating adults. However, enrollment of children is still lagging. While we still plan to enroll eligible adults, we especially need children ages 5 to 17 and their families.
And so we've been kind of hearing how important this is. We've been pushing that idea that it's so important to enroll children, but can you explain why it's so important?
This study will help us understand the health consequences of PFAS exposure in children and in adults as well. There's a new study that links kidney disease in children who were exposed to PFAS before birth. Our study will further explore the effects of exposure during pregnancy. For children, the study will also help us understand the relationship between PFAS exposure and ADHD, autoimmune disorders, lower vaccine response, cancer, and other conditions related to kidney, liver, and thyroid functioning. For adults, the study will further explore the effects of exposure, PFAS exposure, and hypertension, diabetes, high blood pressure, infertility, Parkinson's disease, and conditions related to kidney, liver, and thyroid function.
And so what really does the participation process involve, and what would be some of the incentives, I think, to participating?
There are 3 levels of participation. The first level involves completing a health questionnaire over the phone. At the next level, participants can make an appointment to come into our study office to provide a blood sample. And then children also have the option of participating in a neurobehavioral assessment, which is a series of memory and learning games. Adults can receive up to $50 in gift cards for participating, and children can receive up to $75 in gift cards for participating in all aspects of the study. Participants who provide a blood sample also receive their lab results. The lab results include the levels of PFAS in their blood, and it also includes clinical results that are much more comprehensive than what you would receive from an annual physical. That includes your lipids and also very extensive results in terms of kidney, liver, and thyroid function. And those results are going to be very useful to discuss with your doctor.
Hope and Joanne, I know that you have been heavily involved in helping provide insight and feedback into this ongoing effort to help our healthcare providers really understand what that PFAS reading, that level, actually means for their patients. So can you share more about the new guidance that is now available and what it could mean for our study participants?
Yes, thank you, Susan. NASAM is the National Academy of Science, Engineering, and Medicine, and their recently released PFAS project resulted from affected community members across the country being frustrated that there was no blood test, that there was a blood test for PFAS, but no guidance on what the results really meant. So community organizations asked government agencies to give us some more useful information that we can take to our healthcare provider regarding PFAS exposure and blood testing. Until this past August, we really had no parameters to interpret blood test results. They literally had no meaning, and we were lost as to what type of follow-up care was needed based on our PFAS levels. So Hope, can you tell us about the new guidance?
Sure. I was grateful to be a part of a community liaison for this group. And the new guidance for PFAS blood testing is very user-friendly. NASEM actually offers a color-coded chart to compare your results to. If your PFAS result is less than 2 nanograms per milliliter, it falls into the yellow category, where there are no adverse health effects related to PFAS are expected and no special follow-up is needed. And then if your PFAS blood level falls between 2 and 20, it goes into the orange category, where there is a potential for adverse effects, especially in sensitive populations, and your clinician will be able to prioritize some of your standard screenings for those like high cholesterol or breast cancer. And if your PFAS blood level is 20 or greater, then it falls into the red category, and it puts you in an increased risk of adverse effects from PFAS, and your clinician will screen you for things like high cholesterol, thyroid function, kidney cancer, testicular cancer, and ulcerative colitis. So we're really pleased that this guidance came out to both help the community, participants, the clinicians to know proactive steps, if there are any, needed to be taken after someone has the results.
Thanks, Hope. Thank you so much. Susan, a follow-up question back to you. How does our community's PFAS blood results from the 2018 pilot testing compare with respect to this new NASAM guidance?
So as you just heard, the NASAM report lists these certain levels of PFAS, that the certain numbers in the readings as being a concern for developing these, potentially certain health conditions. So back in 2018, what we found was the average level of total PFAS measured in children back in 2018 for ages 3 to 11. The average was 9.8. Ages 12 to 19, it was 12.7. And for adults, and we categorize adults here as 20 and older, it was 25.73. And as you were hearing from Hope, the level should be more like 2. So this is part of the problem. Really, 100% of our participants that we measured back then had those levels that fall into that moderate or high risk and should be screened for these health conditions. This will be very helpful, I think, for physicians and finally putting a meaning or some semblance of meaning to that number. As we start to wrap things up, I'd like to end with some last thoughts from our legislators. It has been a bit of a concern, I think, for us to know that there are still people out there in the community who aren't aware of PFAS contamination problems, and they're not aware of our study. So if you had one single message to share with your constituents on this topic, what would it be?
Number one, these chemicals are everywhere, number one. And number two, that the health consequences are very real. Those are the two most important messages. If anyone in our community wants additional information, we have a lot of it on our website, fitzpatrick.house.gov/PFAS. And if you live within any of the 11 towns, municipalities eligible for the study, please consider getting tested. As Todd had mentioned, it's quick, it's painless, it's very, very efficient. And while the participation rate amongst adults is very high, we need to up our numbers to encourage youth participation. These tests are confidential, they're free, and they will not only benefit you as an individual, it'll also benefit future generations as we're trying to get our arms around the magnitude of this problem and have a comprehensive bipartisan solution to take care of it and fix it.
Yeah, I would follow up on that. Those are all important points, I think, for people to understand. I would also add, there are some folks that think that these chemicals remain in the public drinking water systems at elevated levels in some of these communities. And as I mentioned, we are remediating to a non-detect standard. So, these local communities now have the highest standards in the country, frankly, for PFAS. And so, I want to reassure folks that, these local water providers in Horsham and Warrington and Warminster in particular, and now some of the surrounding communities are taking the aggressive steps to make sure that the water is safe for people to drink. So make sure you check with your local water provider. You can always ask them specifically for data on PFAS and any contamination within the water system there. And then the second piece is, as Brian said, this study is really important, and we need as many children as possible to participate so that we can help protect all the other children out there. I mean, we are part of a national study, and we worked really hard to make sure that our community was a part of it. And the benefits of that are that our children can help provide some of the baseline health data and other information that will be necessary to protect them personally, and then beyond, protect the broader community, Commonwealth, and country. Children all across the globe will benefit from what we learn from these studies. And so it's an opportunity to give back. It's an opportunity to help others, but it's really an opportunity to protect yourself and your own health and your own family's health as well. So I would encourage, if you haven't already participated in the study, please sign up. If you have children, please get them signed up too. I know, look, I have kids. I know it's not always easy, but it is really important, and it will be tremendously beneficial for all, including yourself. So, let's all band together and continue working together to help solve this problem and understand these contaminants and the health implications that may result from ingesting them.
Yeah, so I do think we've had a wonderful discussion here today about PFAS issues and about our PFAS health study. If you, I'm talking to the public here, if you are interested or know somebody who would be interested in participating with this study, we encourage you to call the hotline. Participation is free, it is voluntary, and I just want to thank everybody for joining us today.